everyone, and thank you for joining today's Caseworthy Impact Series webinar, The State of Aging Services. I'm Kelvin McCord, Director of Marketing and Communications with Caseworthy. We're glad you could join us today, and we will get started in just a moment. But first, a few housekeeping notes. A reminder that today's webinar is being recorded and will be available on demand in the next day or so. It's also going to be uploaded for on-demand access on our website at caseworthy.com, so feel free to visit that as well as other webinars from the past. Also a reminder, as with most webinars, all guests, registrants, microphones, and webcams are muted during the presentation, but we do encourage everyone to participate in today's webinar along with Greg and Bob. Just post your questions using the Q&A button you should see at the bottom of your screen in the menu section. Drop your questions in there and we'll make sure that they get to Bob and Greg toward the end of the webinar. Before we begin today's webinar, I do want to introduce you to our presenters, and today we'll start with our guest, Bob Blancato. Bob is the Executive Director of the National Association of Nutrition and Aging Services Programs. He's also President of Matz Blancato and Associates, the National Coordinator of the bipartisan 3,000-member Elder Justice Coalition, and the National Coordinator of the Defeat Malnutrition Today Coalition. Bob has long been as a national advocate with policy expertise on behalf of older adults. In 2019, he was invited by both the Senate Finance Committee and House Ways and Means Committee to testify on a range of issues. Bob's prior work history includes 17 years as a staffer in Congress and an appointment by President Clinton to be the executive director of the 1995 White House Conference on Aging, one of 4 he has participated in. He's a member of the Senior Executive Service. Bob holds a BA from Georgetown University and an MPA from American University, and has won numerous awards for advocacy, most recently the American Society for Aging's Hall of Fame Award in April of 2021. Also on today's webinar, as Senior Vice President and General Manager at Caseworthy, Greg Prosser oversees the organization's strategic product initiatives. Greg has more than 20 years of leadership experience working with the Aging Services Network. He has worked on strategic partnerships and data analysis projects with Meals on Wheels America, Brown University, and the West Health Institute, in addition to the countless organizations that lean on his institutional knowledge and understanding of best practices for data management. And before joining Caseworthy, Greg was CEO and president of Accessible Solutions Incorporated for more than 20 years. So with those introductions, I will now turn it over to Greg.
Awesome. I appreciate that, Kelvin. Well, thank you for joining me in this conversation, Bob. We've known each other for a long time. During this tenure, the aging services sector has changed quite a bit. I've always appreciated your passion and advocacy for this vulnerable population, and also appreciate you taking the time out of your busy schedule. I know certainly there's a lot going on right now, and we're going to get into some of those topics here in just a few moments, but I really appreciate you taking the time to join us today.
Thank you, Greg. It's good to see you, and I appreciate the work you've done over the years. The Aging Network knows you very well from both your capacities, and especially the current one. And Caseworthy, I want to thank you for holding this webinar. And your webinars have been very important that you've held up to date. I was particularly interested in the one you had on the power of data, which is really a very powerful, important topic right now. And Kelvin, thank you for the nice introduction.
Awesome. So I thought we'd start with just an outline of what the intent was for this call, but I do want to pause on that just for a moment, because we know we're going to take a little bit of a right turn in regards to some of the topics we talk about today, based upon some of the developments that are happening on Capitol Hill at this moment that are really affecting all of those that are on this call. But so I'll kind of circle back around to that in just a second. But you recently participated in a Senate bipartisan roundtable on healthy aging. And that was one of the things that I thought there were a few different data points that came out of that. In that roundtable, you brought really 3 key issues you considered to be the antithesis of healthy aging. The first being impact of the fiscal cliff that many aging programs are facing. The second was malnutrition and nutritional concerns and other nutritional concerns. And the third being elder abuse. So we're going to kind of circle back around to those topics in just a moment here. But since this relevant topic is kind of the center of what we're all addressing right now, let's talk about what's happening in regards to the debt ceiling. And it's a deeply political and divisive conversation situation that we're addressing. And again, as I mentioned, everybody on this call really is affected by what's happening on that front. So I was hoping you could give us a few minutes and talk about what your thoughts were on the subject and kind of where you see this taking a turn next.
Sure, Greg. Just one preface, because we want to stay nonpartisan, I don't want to use the term right turn because some people might interpret that the wrong way. So
There you go.
let's talk about the real here and now. The debt ceiling is an issue that comes up often, but right now this has a higher level of urgency because there's a potential date of June 1st by which, if nothing were done, the United States could face its first default in its history, which is something which nobody wants. So the choice has always been between doing a clean bill where you simply lift the debt ceiling, or one that has conditions, as the House of Representatives has passed, a few weeks ago. As I mentioned, the alternative is default, which would be the worst way for us to go. And right now, literally as we speak right now, they will reconvene this afternoon at the White House, the leadership of Congress and the president. The signals early this afternoon are that they expect real progress to be made. You have things like a Memorial Day recess that both the House and the Senate already is in recess and the House wants to be on recess. But that comes right on the heels of June 1st. And so, dates and deadlines and recesses have a way of pushing things here in Washington. So the question is really, how close are they? Okay. And I'm not a clairvoyant. I can't tell you exactly, but I think the number of issues are down to a handful that have to be resolved. But the ones that are being discussed have the most impact and then most consequences on our work. And so as a result of that, I'm proud to say that my colleague Ellie Hollander and Meals on Wheels America and NANAS, we issued a letter yesterday to the president and to the speaker and to the other leaders of Congress saying, if you're going to be talking about spending caps, putting a cap on spending, have the current fiscal year as your baseline, not the previous fiscal year. And for our purposes in the nutrition program, the difference between those two is $100 million in funding, okay, which could translate into 1 million meals that could be lost to older adults if we don't do anything relative to the if we go to fiscal year 22 versus 23. So we were anticipating that as being one of the conditions in this debt ceilings bill. It's not definitive that it is, but most of the rumors in the street were that we're getting down to 3 or 4 issues, and one of them is about spending caps. So we decided to be proactive, put the move out there, because every conversation that we hear when they talk about consequences, Meals on Wheels, nutrition meals for older adults are always in the conversation. So we wanted to be out there making this happen. So, there is a relationship to the fiscal year funding for fiscal year 24. So let's talk about calendars, okay? June 1st is this date of doom for the debt ceiling, okay? October 1st starts the new fiscal year, okay? We're in fiscal year 23 right now. New fiscal year starts October 1st. I've never seen in my years of being here a process that's running so late and with so much uncertainty. The title of this webinar, The State of Aging Services, is so unclear, like I've not seen in a long time, because of the overhang of the debt ceiling in this whole conversation. And so we don't want to see, as I mentioned, what was in the House passed bill to not only roll back spending to fiscal year 22 levels, but to hold them there for 10 years. Okay, that is the most, in my judgment, that's the most extreme position. Okay, and I don't think you're going to see that in the final debt ceiling bill. But some spending cuts are going to happen, because and I know that if you freeze spending, okay, it's a cut, because inflation goes up, you got additional cost, and so when you say you're going to cap spending, you're talking about a cut. So it's unfortunate that it comes at a time when we're working off a budget proposal that the president put forward that had many good provisions in it dealing with older adults, but we can come to that in the next conversation.
Sounds good. So time will tell at this point where
Yeah.
things go next, right?
Yep.
And I think, we talked a little bit earlier too about, the worst case scenario. And I mentioned this article I read too, the opinion on Bernie Sanders about the possibility of invoking this 14th Amendment. And obviously the goal is that we avoid that, right?
Right.
And what happens if that is attempted is pretty uncertain as well, it sounds like.
Well, yeah, and it is considered one of the more extreme approaches. I mean, there's another approach that hasn't gotten a lot of attention, which could happen, by the way. You can simply vote to extend the debt ceiling for a week or two or whatever. In other words, the current capacity to borrow and whatever, which we do often in the beginning of a fiscal year. You pass what's called a continuing resolution to keep the process as it is for a couple of weeks. I would say that if you reach the point, middle of next week, and you're down to one or two issues, they could just make that June 1st date sort of hold. It could be June 5th, could be June 9th, June 7th, June 8th. Going to the Constitution and the 14th Amendment has its own challenges, okay? Because inevitably it would end up in court, and it would go right to the Supreme Court. There'd be no stopping. It'd go right to the Supreme Court, a level of issue of this significance, and then you couldn't tell how they would rule. And you could end up in a constitutional crisis on top of a debt ceiling crisis, which I don't think we want to get into that situation. Yeah. And I don't think the president does either, but if his hands are tied, he may have no choice.
Totally agree. So let's talk a little bit about the president's aging priorities in regards to funding. Mm-hmm. Maybe you can touch on that. And there's a slide that we had that talked about some of those elements.
Yeah, I'll come to this part in a minute, but I think before we get there, I want to talk about the president's budget as it relates to aging services programs that we care a lot about. The president has a very ambitious and positive budget for the Older Americans Act, as an example. His budget would increase funding for Title IIIB support services by $90 million. He would increase nutrition funding by over $200 million, which would be its single biggest increase in its history. It would add money for the preventative health provisions of the Older Americans Act. The Family Caregiver Program would get an increase. The Native American Nutrition Program would almost have its funding doubled. And elder abuse prevention services would have their fundings increased too. But I think what's also important in what's in the president's budget, and you know this, Greg, from all your years of working in this space, a number of years ago, we finally achieved what's called rebalancing of Medicaid, meaning that prior to that point, we were spending more on institutional care in Medicaid than we were in home and community-based care. That stopped about 4 or 5 years ago due to a lot of work on the part of advocates. But now you have a situation where, because there's so much demand for home and community-based services, you have a waiting list in this country of over 800,000 people waiting to get home and community-based services. And part of the reason why there's a waiting list is because of workforce shortages. So the president has proposed $150 billion in new Medicaid's home and community-based services funding to address both those issues. That may be the most important thing in this budget as it relates to aging services and programs, because that's the one that really counts a lot. Now, as we see on this slide, many of you remember last year, the Inflation Reduction Act was passed by Congress in the previous Congress. A very historic bill that did two very significant things that aging advocates have been pushing for a long time. Number one was imposing a $2,000 out-of-pocket cap on Medicare Part D spending. An older adult would not have to spend any more than $2,000 in out-of-pocket costs for their Part D drugs, which is important because many, many older adults spend way more than that. And the second thing is Medicare, for the first time in its history under the IRA, can negotiate for the price of drugs under Medicare Part D. Okay, they'll start with 10 in 2026 and 15 later. But the other thing that's important too is that in the president's budget, he's also saying that penalties can be imposed on drug companies if they raise their prices higher than inflation. So these are things, because healthcare cost, as you know, is an overriding concern to America's seniors and their families. And one of the main areas is in drug pricing. So these things, along with the president's also called for greater support for mental health coverage under Medicare, which is something which we really have to focus on now because of the pandemic and its impact. So the president has put forward a really good budget, but we can't go anywhere with his budget or any alternative budget until we know where this debt ceiling thing ends up.
Got it. Makes sense. Difficult times. That would also kind of continue that conversation just about the budget aspect, and I know elder justice was another aspect of that in regards to the Reauthorization Modernization Act. I don't know if you wanted to touch on that just a little bit in regards to that.
Well, I want to go back to your earlier point about the Senate Roundtable, because that was a very important initiative. I want to share with you the senators that participated in that roundtable, because some of your folks on this webinar may have them as your senators. Senator Sanders, the chairman of the Senate Health, Education, and Labor Pensions Committee, convened the roundtable, and he was joined that day by Senator Casey from Pennsylvania, who's chairman of the Senate Aging Committee, Senator Hassan from New Hampshire, Senator Tina Smith from Minnesota, Senator Mike Braun from Indiana, and Senator Hickenlooper from Colorado. And they were all participants, making it a bipartisan event. And the focus was on healthy aging. And as you mentioned, I talked about those issues that really don't constitute healthy aging, like elder abuse. And, in this nation, 1 out of every 10 older adults is still a victim of elder abuse. Mm-hmm. Older adults who are victims of financial abuse lose up to $3 to $3.5 billion a year in loss, including life savings of their entire life savings. And what really probably motivated Congress to act as it did during the pandemic to provide major new funding for elder justice was the fact that we had COVID scams. I mean, that just proliferated out of nowhere. As soon as things started to happen, older adults would get these phone calls, come and get your test, a test they could get for free, and somebody charged them $50 to get a test. Come here in line and we can get you in front of the line for a vaccine. Okay. And it turned out not to be true. It was happening way too much. And members of Congress were getting calls from their constituents. There were members of Congress whose families were impacted by these scams. So they came along and said, look, we got to do something about this. And they put more money into fighting elder justice through funding elder adult protective services. We also had situation in nursing homes that that we had terrible conditions in nursing homes caused by failure to prepare from the standpoint of emergency preparedness, infection control, and staffing. You had a staffing shortage before the pandemic, and they got more exacerbated during the pandemic when many people were leaving their positions in nursing homes. Mm-hmm. So yes, elder abuse is not healthy aging. It's not good for our country to have elder abuse. So we have an Elder Justice Act that was first passed in 2010, which now is going to be, we hope to get reauthorized and modernized in this year. And the bill is called the Elder Justice Reauthorization and Modernization Act. And it would really invest, and I want to use the word invest versus expenditure. Because if you're putting money into elder justice, you're focusing on elder abuse prevention, okay? So the bill would authorize $4.5 billion over 4 years to create what we want to have, an elder justice infrastructure. What does that mean? Funding for adult protective services, better training for the long-term care ombudsman, more funding for staffing, okay? And more funding for legal hotlines and medical legal partnerships. And finally, a very important initiative to provide a new grant program for area agencies and community-based organizations dealing with social isolation. So this is a bill that's pending, but as this slide will show you, we have a bigger challenge that's more immediate, and that's funding for right now. Because as I mentioned, Congress gave adult protective services a lot of money during the pandemic, but that was different money. That's emergency money, pandemic only money. And when that ran out, that goes to the issue of the fiscal cliff I was talking about at that roundtable. Their funding went from $188 million to $15 million, a 90% increase in funding. So we're trying to get that money back. The president has called for $58 million. We're trying to get $80 million in for APS, and also $50 million for ombudsman. Because I mentioned about ombudsman having access to nursing homes to investigate abuse in those facilities. They also now go into assisted living facilities, which is an important area for them to be in, but they need more resources to do that. So the problem is that, the funding levels that we currently have don't reflect the situation on the ground. For those that are on this webinar who in the field know that there's going to be more elder abuse being reported as the pandemic winds down. Okay, and there'll be more need to have people on the ground to respond to those calls. And ombudsmen are returning to nursing homes. So we need you to, I was given a speech in Michigan on Monday, and I indicated who was on the appropriations committee that funds programs, and Senator Peters is on that. It's important for you to know, those of you on this webinar, if your senator or House member sits on these relevant committees that are important, like appropriations. And if they do, they need to hear from you about the need to increase funding. So that's kind of where we are with elder justice right now.
It seems like a common thread, I think, in the conversation is always about advocacy, outreach, talking to the House, the senators, and your local area, knowing who sits on these certain panels and our members to make sure that we're reaching out to the right folks and trying to do what we can in our local communities to help change and influence. I mean, that's a common thread, it sounds like. Right,
and I think it's important to know that all the aging service groups that that we work together with, whether it's NANAS, RMOA, National Council on Aging, U.S. Aging, Advancing States. If you're a member of any of those groups, they have tools for you on how you do advocacy. How do you contact your member of Congress? What's the message you want to give? And those tools are available, and people should utilize them. We put QR codes out sometimes that tell people, make contact this way. People, if you ask people, they do things. I mentioned when I talked about the opportunity I had in Detroit the other day to speak. I was so impressed with the level of interest and on the part of people in that audience about wanting to reach out to their Michigan members about funding the Farm Bill to make sure that the SNAP program continues, things of that nature. So, House members and Senate members hear from us all the time. Okay, they don't want to hear from us all the time. They want to go home and hear the same issue brought to them when they go to the Rotary Club or when they go out and do a local event. If somebody gets up and says, fund more, give more money for elder justice, okay, they're going to listen to that and then go back to their staff and say, okay, what are we doing in that space? But the job of local advocates is to raise the issue at home, because I don't care. I've been doing this a long time, as you know, Greg. I don't care how complicated the issue is. If you know how to localize it and humanize it, you'll get the attention of an elected official.
Yeah, well said. Appreciate that insight. So for everybody listening, take those words to heart for sure. Thought we'd transition a little bit into the second element of that Senate roundtable, if that's okay. And that was in regards to malnutrition. And I know the nutrition programs have tried to adapt methods of service delivery upon challenges for so many local service agencies. And the pandemic came in, of course, we had less volunteers on the street to go deliver meals to folks. We had more people that needed to be served. And prior to that pandemic, of course, the model, generally speaking, let's say, was a hot meal. The wellness check happened at the point of delivery, eyes on the client, that vulnerable population. And the transition occurred to go to a once a week model for delivery, in many cases at least, to frozen meal delivery. And of course, with that, and some organizations started offering choice menu offerings. And so we kind of saw a little bit of a push to a new model in regards to the meal delivery side of things. So my question to you kind of is this, in regards to where we're at today. Are these changes that we've seen in the service delivery models, are they doing anything to help on the malnutrition front or nutritional concerns that our nation's facing, or do you think there's something else that we need to consider in regards to that aspect?
Well, let's go back to one very basic point. Those folks in the nutrition space, those folks in the overall aging services space, your companies that help these the staffs of area agencies and nutrition programs all deserve a ton of credit for getting through this pandemic. Nobody had a playbook. It just came to them. Now, you take the nutrition program alone in the Older Americans Act. Before the pandemic, 2/3 of older adults who got meals got them in congregate settings. Within a week after the pandemic was declared, 98% or more were getting those meals at home. And I remember I was invited to testify before Congress on a funding proposal for the nutrition program. And I turned to the collective group that was there from on the subcommittee I was testifying before. And I said, this is a real life scenario for you. On Monday of this week, there was a senior center in your district that served 100 people with a lunch. By Friday of that week, those same 100 people had to get served in 100 different places, their homes, okay? More transportation costs, more personnel costs, more preparation costs. I said, you need to anticipate this as a change that needs to be funded. And they gave $1.6 billion to the Older Americans Act Nutrition Program during the pandemic to address those very issues. Okay. But meanwhile, people got very innovative. They developed partnerships, for example, with restaurants and other like facilities in their area to help them out as well, because they too were losing business during the pandemic. There's some marvelous public-private partnerships out there that need to continue and will continue. You had grab-and-go meals that were developed by people, again, without a playbook, but they realized that was an interim step for a lot of folks. Okay, if you couldn't go inside the facility, you could still drive up. And I went to see one of these facilities in Missouri one day. And what they did was they would drive up in the van or the car, and the staff would come out and say, hi, how many people are in, how many meals do you need today? Or how many people are in the car, or whatever it is, giving them one hello, one check, so to speak, how they're doing. And then they come back a second time to actually give them the meal and do a second check. So at least there was some contact between, the staff and the individual getting the meal. Another interesting thing we're learning from a survey that we have in the field with the work with the Nutrition Resource Center of ACL is that the grab and go has brought a lot of younger older adults into this program, because the Older Americans Act is 60 and above for eligibility. This grab and go has brought a whole bunch of new people into the program. So grab and go, where relevant, may still be important, because it'll take some time for some programs to reopen. But I think, going to the other question about malnutrition, there's a funding question that first we have to address that goes into that very issue. The SNAP program, also known as the food stamp program for a lot of people. During the pandemic, the benefits were raised for the SNAP beneficiaries to help them meet the challenges of the pandemic and inflation, okay? So older adults, who sometimes were the latest ones to come into the SNAP program because of eligibility issues and so on, they were getting a benefit that was up to $253 a month. And then when the pandemic money stopped in March, their benefit went down to $23 a month. Okay, now what are you going to be able to buy for $23 a month? Not nutritious food. And that's where, and this is where the White House conference that was held last year on hunger, nutrition, and health comes into play.
Perfect.
There were a call for us to do what we should have done years ago, change the food pricing paradigm. Why is it that lousy food is so cheap and easy to get and good food is so expensive? Okay. If we're really talking about improving the quality of nutrition, we've got to start there. And if we have any doubt in our mind about the impact of malnutrition, the Centers for Disease Control just came out with a report that said we've had a doubling of death by malnutrition between 2018 and 2022. So it is a real public health issue. But some of it can be addressed by rearranging some of our priorities at the federal government level in terms of where we put our money into nutrition programs. And consumers also have to help in this situation. Okay, they've got a demand, okay, at the grocery store level and anywhere else that they get their food, that they want to have better quality food, or they're not going to get it from that store. I mean, people can change the dynamic if they raise the issue. And I think we're finally reaching the point where the relationship between nutrition and health is so obvious now. It's so clear. I mean, the major chronic diseases that older adults can get can be prevented by good nutrition, but you need to do this throughout the lifespan. So both the White House conference and these changes in meal delivery and so on in the pandemic, I think, are going to help us address some issues around malnutrition. But we need to, because 1 out of every 2 older adults in this country is either malnourished or at risk of malnutrition. And that's a serious problem.
Yeah, I think it's interesting you touching on like the grab and go, the restaurant programs. Some of these data points and we saw that happening in that pandemic era where a lot of our customers had to pivot quickly, and it was amazing to see what the industry did and how folks stepped up and served the people, so served those vulnerable, found alternative methods for this, and it really forced folks like us on the technology front to say, all right, what do we need to do differently to support these organizations and do it quickly? And some of that came for us as well with partnering up with other organizations that had good restaurant program management solutions, for example, or we touched a little bit on at some point wellness checks, because we only saw folks maybe once a week. Well, what's happening between in the 7 days between when I see them? Maybe I can make a phone call and make sure that they're doing okay with the telephone reassurance. And so those models again just transitioned, and it really affected how we're utilizing some of the funds and delivering those services. And so
and you add to that too the development and the expansion of medically tailored meals that are now available through more channels than they ever were before. And that's very important for a number of people in the older adult population, as culturally appropriate meals are too. The goal is to get people to these programs in a way that makes them participate and want to have the food that's being available. And I can't say enough about how companies like Caseworthy and people involved in the tech world, have done a lot to help aging service programs a lot, because staff time, was more pressurized during the pandemic, more demand, sometimes fewer staff because of issues related to COVID. And new inventions, new innovations have come along to facilitate the work of folks in the working day and the aging network. And kudos to you and other people who are recognize that as a need going forward.
Yeah, appreciate that. Yeah, and it makes me think on, talking about data and the importance of it actually at the NANOS conference next month in Philadelphia. I'm going to be talking about that. And you mentioned at one point the Power of Data webinar that we did. We're going to take a flavor of that webinar. I'm going to do it with Lisa Labani. We're going to talk about restaurant dining programs as well as part of that presentation with the power of data, building capacities to strengthen operations. So, data is a powerful storytelling tool, and it allows us to go, advocate for additional funding, alternative funding. We talk about medically tailored meals you touched on, Medicare Advantage funding that's coming in now for those chronic clients with those chronic conditions, because again, food is medicine, and we know that now. And so it's just, I don't know, any additional comments you want to make on that?
Well, data, you can't understate. I'll take it from my advocacy standpoint. Data drives dollars.
Yeah.
Okay. And if you have decent data when you're going in trying to pitch for funding levels from one year to the next, if you have good data, you have a better chance. Okay. If your data is not clear or, not persuasive, then it's not going to work. So it's very important to do that. And it's also, in advocacy, and I hear this, we deal with congressional staff and members and senators all the time. They tell us the same thing. Don't come and talk to us unless you're coming here with a bipartisan message, that your data and your stories are up to date. Okay. Can't underestimate the importance of all three.
Absolutely. Yep. 100%. Last slide I'm going to share here real quick. Hopefully it's sharing. Do you see that slide? All right. Great. Appreciate it. Let's talk briefly about the NANOS conference course. We've got 28 days before the conference starts, June 21st, 22nd, 23rd in Philadelphia. Matter of fact, actually, I grew up in Southern California. I relocated, actually took an opportunity to take a job in Philadelphia when I was 22 years old. And so I lived there for 2 years, actually. And so it was an eye-opening experience for me in a transition. So I'm excited to go back to Philadelphia here in a few weeks, see you and a lot of our customers and members across the NANOS organization, membership organization. So just want to take an opportunity to make sure I plug that. I'll give you obviously a moment to say anything else, but really this is an opportunity for those folks that attend to educate yourself, network with peers, consult with vendors in the space, and see how you can use innovation, power of data to impact the folks that you're serving. So I'll let you comment on that, Bob.
Well, you did a better commercial than I could do, really. I appreciate that as the executive director of NANOS. Yeah, we're very excited about this conference. We're very excited a couple of reasons. One is the sessions that have been approved to be seen there, and it is about creating connections. I think the second thing is that I'm delighted that our acting administrator of the Administration for Community Living, Allison Barkoff, is going to join us and bring us up to date from the perspective of the administration on aging issues. But also my dear friend Naja Orr, who runs the Philadelphia Corporation on Aging, they're partnering with us on this conference to give us enough sense of a local flavor. But I think what you're going to see is kind of where, and this really applies to aging conferences in general. It's very important to look at the sessions that are being done at a conference. That gives you a sense of where things are going. Okay, what direction things are going. What's the emphasis right now? What's the topics going to be like? And I know that better nutrition, medically tailored meals, prevention, these are all things that come into play. And the role, and you mentioned Medicare Advantage, and let's not forget managed care. The important thing for this aging network to realize is that they shouldn't give away anything for free. Okay, they're at a point now where their services are needed by big entities in Medicare Advantage and in managed care. Okay, if we're going to focus on non-medical supplemental services for chronically ill individuals, this is what this network has been doing for years. But I don't necessarily think that they're that way in a business sense. It's time to do that, okay? Because the value of these services can be measured, and they can be measured two ways, both in terms of dollars and in terms of outcomes, okay? The betterment of the older person who gets the intervention of this service. So we're going to spend some time talking about best practices of who's doing the good work in terms of contracting for business, and also, just remembering that there's a lot of people who've been out there for a long time working who are just recovering themselves from the extra stress caused by the pandemic. We want to celebrate what's been done and look to the future.
100%. All right, that being said, let's take a few moments. Hopefully we've got, I want to encourage those who've listened to the session here, the wisdom that Bob shared with us all, and let's talk about any questions that anybody has. Kelvin, anything that's queued up so far?
Yeah, thank you again, Bob and Greg, for a wonderful, insightful conversation. There's one comment and one question that have come in so far, and I think, Bob, just going back, Lise had added a comment in our comment section that I think reiterated and sort of talked a little bit more about what you were talking about with regard to how the pandemic impacted meal delivery, how folks were sort of left to their own devices in some situations. And she said, it was really a great disadvantage to the older adults in rural areas who, as you can imagine, don't have reliable transportation. So, feel free to comment on that as well. But that was something she put into the comment section. Yeah, no, you're absolutely correct. And I happen to be a member of the National Advisory Committee on Rural Health and Human Services, and it's been eye-opening to recognize the disparities, if you will, between rural America and non-rural America, so to speak. And there are two places where efforts are being made to improve on that. One is in the broadband space. Okay, I mean, we realize the digital divide still is a reality in our life, and there's been major investments put into improving access to broadband in rural America, which can improve and also help in aging service provision and delivery. On the transportation side, that is a place where, we continue as a nation to fall short. We don't recognize the importance of transportation in achieving effective service delivery for older adults. And, there are worthwhile programs out there. They just need to be given more resources. And I think you'll finally see in this, probably the next go around, particularly when the Older Americans Act comes up for renewal next year, along with some related transportation bills, there will be a distinct focus on the rural older adult. Because remember, in the Older Americans Act, services are to be targeted to the older adult in the greatest economic or social need, which includes very specifically rural older adults. And so I think you're going to finally see, because of the impact of the pandemic that was unique to rural America, some remedies and some changes that will come about. And I hope, since you raised the point, that you will join in the advocacy effort to ensure
a better response toward rural older adults.
All right, very good. Thank you, Bob. Another question that came in is, how can case managers and social workers shift their service delivery to help the aging population?
Interesting question. Well, I mean, first of all, it's my belief that in many existing aging service programs, you have a lot of social workers in those programs as it is. And, case managers are also, part of many, many area agencies on aging that I know in other parts of the country. Their work now, I think, is a lot about ensuring, particularly on the benefit side of things, making sure that people who are eligible for federal programs, know about the program, enroll in the program, get the benefit of that program. We have too many older adults who are not participating in the programs they should. We talked about the SNAP program before. We're still under 50% of older adults who could be eligible for SNAP who are participating in SNAP. And, the ARP Foundation, I'm proud to be a board member of the ARP Foundation. They do great work in doing outreach to get people on SNAP, the National Council on Aging. But the individual case manager, the case worker in local area agencies on aging also need to play a role in that area, to identify, do the outreach to find out who needs the services. So if anything, I suspect that there's going to be a greater recognition of the importance of casework and case managers and coordinating of services than ever before. That's always been a part of the aging network, but now we got to get a little more granular and start identifying what it is that we want to have folks doing to get older adults the best kind of programs that they can. And social workers, in my judgment, there's so much more they could be doing in so many aspects of the aging space. They have a unique perspective. They're well trained to walk right in and help any human service agency. They need greater recognition as being a support entity for older adults.
Well said.
Great. Thank you, Bob. I actually have a question for you myself. This is a bit of an anecdotal question, but you touched on malnutrition today. You touched on elder abuse and meal delivery and some of the other topics. One of the things that, a topic that seems to be top of mind and topical is the housing situation and affordable housing. And I'm wondering if you could touch on anything. I'm sure that's, part of the discussion with policymakers in Washington, but I know that a lot of seniors are even more concerned with rising rents and, again, affordable housing options. So maybe you can touch on that. Yeah,
thank you, Kelvin. That's a very, very important question. And I think where we're finally seeing a recognition of the importance of housing is now that we are finally addressing, whether you call them the social determinants of health or the social drivers of health, housing and transportation are right at the core. And the availability and affordability of housing for older adults is a genuine problem. President's budget does call for additional funding for affordable housing for older adults, but these programs were built a long time ago in a different context. We had a program, still have a program called the Section 202 and Section 8 housing programs that were specifically identified for older adults and persons with disabilities. Well, they got money for the structure, but it took a separate piece of advocacy and effort to get service coordination into those same facilities, so that a person who goes into that facility, and a senior resident, can get access to these services. I suspect now that you're finally seeing a recognition of the connection between having services in these affordable housing programs for older adults. But I think now, because there is this focus on social determinants and on equity, by the way, let's also not forget that equity plays into this conversation as well, because those who are unable to afford decent housing, have historically been unable to afford it because it's not been available to them. We've got to examine why that's the case, why we have this systemic disparity in housing opportunities for people in this country. And I think we're having a national conversation little by little. You know, sometimes just getting past denial is very important. Okay, you can't deny that we have a problem with disparities. You cannot deny that we have a problem with diversity, equity, and inclusion. And you also can't deny that some of our programs have not been developed with those most in need in mind. And I think that's where we need to go. And housing would be a great place to start. But the president, in my judgment, is doing a good job of recognizing and putting resources into more housing. It's up for Congress now to accept his proposal.
All right, sounds great. We have two more questions and then we'll put a wrap on it. But the first one is from Amanda. Do you expect these challenges, debt limit, default threats, fight for enough funding to care for the aging population, et cetera, do you expect that to continue arising year after year? Or is there a paradigm shift that is needed in our society regarding how we view elders?
Well, on the first part of that question, let's hope not. I mean, you know, I don't know the schedule by which we would have to confront a debt ceiling again. But let's just say that whatever is the resolution of this debt ceiling crisis, let's hope that it's long enough to, you know, keep it from being a front and center issue again. But it also, as I mentioned, has consequences in how it's resolved. Okay, does it come at what cost, if you will? The challenges of dealing with aging society and having adequate funding will go on year to year. It's inevitable. I mean, the issue is we have great programs for older adults in this country. We have Medicare, we have Social Security, we have Medicaid, we have the Older Americans Act, but we do not have a national aging policy in this country that would put the pieces together in such a way that would give us the full impact of improving the quality of life for older adults. And that's what we have to strive to do. And, you know, thank goodness for the leadership of my colleagues who run national aging organizations, Meals on Wheels America, NCOA, US Aging, Advancing States. You know, we're all working together like in an unprecedented level to have the most effective voice available. And our job here in Washington is to find our champions, find our friends who are going to join us and be supportive of this. And those of you on this webinar need to do the same thing. Okay, learn who your member of Congress is, if you know it, most of you do, but not so much that, but what committees do they serve on? What are their priorities? And when was the last time you connected with them? Okay, if you really care about some of these issues, they need to hear about it because they're the ones who can make the change. And we'll help you any way we can at NASP and the same groups that I mentioned before.
All right, Bob, last question. And just a reminder, if anyone has questions that go unanswered here because of our time limit, then we will do our best to reach out to you outside of this webinar. But Bob, the last question, what role does or should Medicaid have related to behavioral health care when Medicare and Medicare Advantage plans have limited psychiatric coverage?
Very good question. Medicaid has a huge role in that space. And I think the administration has taken some initiatives to expand Medicaid coverage for behavioral health. There's new initiatives in Medicare in that same space. This is the same administration that created the 988 hotline, the new number, the one size fit all number, if you will, for addressing behavioral health issues around suicide prevention and things of that nature. The pandemic, right, badly or not, gives us a whole new perspective on behavioral health. Okay, some of the consequences that occurred because of the pandemic. If you look carefully, and we're happy to share information on what this administration and what folks in Congress are doing to address behavioral health through not only the Medicaid and Medicare programs, but other public health programs that are out there. So you raise a very relevant point that is getting way more attention now than I've seen in a long time, and it should. Because again, our goal is to improve the quality of life, and health for people in this country, and behavioral health investments have to be made. And I'm confident that you're going to see a lot more of that in the years ahead because people are speaking out on it, talking about it, and can share those stories that I talk about being so important. And you have data now that's showing where behavioral health is becoming a cost issue for this country. So thank you for raising that, and I feel pretty confident that we're seeing movement in that space.
Very good. Thank you, Bob. Thank you, Greg. Again, Bob Lancato, Executive Director of the National Association of Nutrition and Aging Services Programs, and Greg Prosser, Executive Vice President and General Manager at Caseworthy. Thank you both for your time today. Wonderful, wonderful conversation on a very important issue.